Hi, shockwave people. I just want to give you a quick tip on treating tennis elbow, okay? So one of the problems we have with tennis elbow when you're using radial pressure wave, or EPAT as it's known in the States, is that it's quite tender when you do the treatment. So I've set this to 2 bar pressure and 21 hertz because I think you should start with a nice high hertz, but I wouldn't normally start with 2 bar pressure. That is simply to make the point. So we put the machine on, stick it on my tennis elbow, and that, even with the high hertz, is really quite sore to do. So here's a little tip. Build yourself up a little Mr. Whippy of the gel, and then give yourself a bigger standoff and sit in the top of the gel there. That makes it much easier in terms of discomfort, and at the high hertz it really helps. And then slowly you depress down until the patient reports a discomfort of around 4 out of 10. So I'm in the gel, slowly push down, and now I can feel that, and that's a 4 out of 10. So I can stay there, and as the hyperstimulation anesthesia starts to kick in, I can start to press deeper and deeper and deeper. Then what happens is I reduce the hertz down to a more normal level of around 12 to 14, maybe even dropping down to 10, and then I've got my nice therapeutic treatment. But it's a nice way, using that Mr. Whippy build-up of gel, to really get the best benefit for your patient, so they don't go around telling everyone, oh, shockwave's really painful. You can build it up nice and gently. As I said, I would start at 1.5 bar and then build up, but just for this demonstration I wanted to get a gauge of how sore that would be and how easy it is to make that nice and pain-free, or certainly pain tolerance. Always tell your patient it's not sensation-free. The minute you mention the word painful, their pain sensors go off and you get a different reaction. So tell them we need to get a sensation of about 4 or 5 out of 10, but using a big gel build-up is a really nice way on those sensitive areas. It also works on medial tibial stress syndrome, or shin splints, and around the ankle as well. It enables you to use the radial pressure wave, if you don't have a focus machine, to be able to treat some of these areas in a nice way that's effective for your patient and doesn't leave them writhing around in agony. Hope that helps.